Hi, it's Marcel of Strong for Life.
And Ausra.
And today we're talking about a topic that is really popular and a problem that a lot of my clients come to me for, which is sciatic pain. Now, sciatic pain can be often confused with other forms of injuries, but we're going to talk specifically about sciatic pain. And sciatic pain is a real pain because it's something that can really affect your entire life. It can disturb your sleep. It can make you feel very unwell. Obviously, it's painful. But it's important that you recognize and that you know what is correct. What is sciatic pain, and is it actually that, or is it something else? So I'm going to try my best to describe to you exactly what sciatic pain is. So I'm going to use Ausra as a model here. If you could just stand for me here. Sciatic pain generally occurs from the lower back down towards behind the leg, and often sometimes even down to, if you lift your leg for me, even down to the toes here as well. And it'll be very often radiating down to the little toes. Doesn't tend to go into the big toes, it goes down to the little toes. So it often radiates down behind the knee, into the calf. Sometimes it stops there. Otherwise, it can also radiate down towards the little toe. Okay, so that's the more common symptoms or signs of sciatic pain. So it's not that it'll be localized just in the lower back, and it's not that it's just localized in the gluteal area. It's very often a radiating or shooting pain that goes down the leg. That's more of a confirmed sciatica. So if you have that and you're in the acute stages, what I want to try and guide you through is how do you manage that to make it as comfortable as possible. In another video, I'll show you the type of exercises that you can do to try and protect and prevent against it. But in this one, we're going to talk about how we can make this as comfortable for you if you're suffering from sciatic pain. Okay? So Ausra again is going to be my fantastic model. And what we're going to do is we're going to start with imagining that this is your bed. Okay? So if you go ahead and get on the bed for me, but don't lie down for me just yet. You're going to go on the bed and you're going to go face down, and we're going to put this under your belly. Okay? So if you go ahead and lie that on top of that. Now, Ausra normally works with people who want to strengthen their backs and so on, and being aware of back pain is actually very important. So just being in this position, whereby there are cushions underneath the spine, can actually be very effective at alleviating the pain. So this is one of the first things you should do to try and activate that alleviation. If you feel that you need more cushions and that it's kind of taking the edge off, but it's not enough, put more. You can always put more until you're almost in a curved C shape over the cushion, as long as you're in a comfortable position and it takes the pressure off your back. So if that works really well for you, then obviously that's one to start with. Another one to start with is to actually allow the spinal muscles and the spine joints themselves to open out to give more space for the sciatic nerve. It might actually be more effective to work in the opposite direction. So let me show you what that is. So if we take those out from under you, thank you. Put those away. That's it, and you're just going to lie down for me flat. Good. Now you may find out, as we mentioned before, Ausra is hyperlordotic, so there's a possibility that she could suffer from sciatic pain. She doesn't, but she does sometimes suffer from back pain. That's another video. However, if Ausra were to suffer from sciatic pain, one way that you can alleviate that is by creating more of a curve in the lumbar spine. So there are a couple of ways we can do that very simply. If you're lying on your bed and you're lying flat, but this might not be very comfortable for you, if you pop your elbows underneath your shoulders, as if you were going to do a press up, but leaving your hips down. So slide your elbows forward a bit more, there, and now just lift up slightly. There, that's fine. And this would be a level 1 type of activity. So you would move from this position, from the chest on the bed, up to where the shoulders are just lifted off, and you may find that that's enough to give you some relief. You can hold that position and then relax it back down again. And this will be an exercise in itself to help open out the vertebrae in order to allow a little bit more space for the sciatic to run more freely. Now, you can progress that up again. For some people, they may find they need to increase the angle at the lumbar spine. So if you do the same thing again, except it's more like the cobra pose, that's it. And now there's an even more acute angle here in the lower back, between the glutes and the lower back, where the stomach is still, the hip and stomach is still on the couch, but there's a more acute angle in the lumbar spine, and that is now resulting in a much, much more acute curve, which again can provide an awful lot more relief. Okay, and then finally, can you go up onto straight arms? So Ash can now go up into a full cobra pose, and that is where she's able to then fully curve her back. Her hips have slightly lifted off, but it's entirely feasible that now that this position either might be slightly uncomfortable or might alleviate the discomfort altogether. So this is a very, very effective way of alleviating the lower back. Okay, so if you relax back down into a complex position. Okay, another position that we can do, which is basically a bit like the recovery position, is another way, because sometimes sciatic pain radiates left or right. Very often it's down one side, not often down both sides. So what that means is we can do is that we can alleviate the pressure on that one side by doing a recovery position with that thigh. So if I give you a cushion for your head, and what I want you to do, exactly like that, but you're not going to lift your hips quite so much. Your leg's going to go out, and we're going to lift this leg up like that, exactly. And so now you can see that the knee has come out, and it's slightly tilted the pelvis, and that can help to give relief for the sciatic nerve very, very effectively as well. The height of the knee is something you need to measure, but this again can be a much more comfortable position if you are suffering from sciatic pain that's radiating down your leg or down towards your toe. And you'll obviously know, because it will immediately alleviate that level of discomfort and make it much easier for you. And it's a good position to perhaps even sleep in if it's something that you obviously need to be able to get back to doing. Okay, so this is a very, very effective way of alleviating the sciatic nerve. Okay, so what we can do now, having tried this sort of recovery position first, what we can then do is move on to another angled position. Okay, so we're going to change it up and again bring back those cushions. So if you take that one away from your head there and pop it under your belly again, and we can do that. And now you're going to lie face down on there, except you're going to bring your legs over towards the front side of the couch here, exactly, but your torso stays straight for now. That's it, like that. So now what's happening is her legs are over towards the right side or a bit closer to you, and so we've got this almost C shape happening here, almost an L actually, less of a C, almost a small L. Okay, and again what that's going to do is, again, if it's one directional sciatic pain, let's say the left side, then rotating or tilting the legs towards the right is going to open out the lumbar spine really nicely. So that would work very effectively. Alternatively, if you went to the left, if you scooch on over to the left side of the couch, that's it. And the idea here is to open out the hips and pelvis and allow the lumbar spine also to alleviate there and open out on the right side. That could also be very effective for relieving the lumbar area as well, and obviously the sciatic pain. Okay, so those are the exercises for today. You can come back up if you like to.
It feels rather nice.
I'm sure, very comfortable, right? Good. So those are the exercises for today. If you've got any comments or if you've liked any of those or if they've worked for you, please put a comment below. We'd love to hear from you. Obviously, remember to like and subscribe to the video and make sure you hit that notification bell, because that will notify you whenever I release a new video with Ashra. We've got a lot more coming up as well. So stay tuned. Please hit that like button as well. And otherwise, we'll see you very, very soon in our next video. Bye-bye for now.